Hi, I'm Lysa Buonanno. Welcome to Hope with Answers.
And I'm Dr. Jessica Donington. I'm a general thoracic surgeon who specializes in lung cancer surgery.
And today we're going to talk about surgery options for early stage lung cancer patients. So what types of surgeries are there?
So we define our surgeries for early stage disease in two ways. One, how much lung we take, and two, how we get through the chest wall to get there. In terms of how much lung we take, the standard answer for patients who have stage 1 or stage 2 disease is that we do a lobectomy. That's 1/3 of the lung on the right or half the lung on the left. With that, we take not only the tumor, but the tissues around it, all of the lymph nodes, and the blood vessels that feed that lobe. We know that for patients with very small tumors, those less than 2 centimeters, that sometimes something called a segment or a segmentectomy works, and that's a portion of that lobe. But again, you have to take all the lymph nodes and all the blood vessels that go to that region to assure you don't miss any cancer cells which may have spread.
And can you explain to us the difference between a thoracotomy and a VATS procedure?
Sure. So that kind of gets into how we get through the chest wall. So it's not just what we take out once we're in there, but how we go through. A thoracotomy is we call an open operation. It's usually an incision that's about 8 to 10 inches long, and we actually go between the ribs and we put our hands in to do the operation. And for decades, that was the main approach for lung cancer surgery. In the last kind of 20 years at the most, we've developed minimally invasive techniques using either a robot or a video camera with small incisions, 1 to 3 centimeters in size, to go in and do the same exact operation. The advantage of the minimally invasive approach is that it hurts less. The recovery is faster. People get back to their normal self so much better without being a worse operation in terms of cancer treatment.
Well, thank you so much for that great in-depth explanation, and thanks for joining us with Hope with Answers.
My pleasure.